Hello, everyone, and thank you for joining us. This event is part of Duke and DC's Beyond Talking Point series, and the conversation today is about health inequalities and racial injustice during COVID-19. I'm Teresa Wiltz, the senior editor for Washington and Politics at Politico, and our panelists today are Keisha Bentley-Edwards, who's assistant professor in medicine, affiliate of the Duke Global Health Institute, member of the Duke Cancer Institute, and director of the Health Equity Working Group for the Duke Samuel Du Bois Cook Center on Social Equity. That's a mouthful. And then we have Tiffany Day, who is the Systems Change and Policy Analyst at the Gassman Institute Ascend program. She partners with key states, counties, communities, agencies, and families to further develop and advance a systems change and policy agenda that promotes equitable opportunities for children and families. And then we have Anna Gassman-Pines, who is a professor of public policy, psychology, and neuroscience. She's a faculty research scholar of Dupree's Population Research Center, and her research area of expertise is children and families. So I wanted to just get started with a question. I'm just wondering, what are some of the most pronounced ways the pandemic has impacted working families? Anna?
Thank you so much, Teresa, and thank you for having me. In the work that I've been doing, I've been following a large representative sample of hourly service workers with young children. Mm-hmm. And we started this work with this group of families before the pandemic started, and then have followed them over the last year. And what we're really seeing is that the job loss and instability that has come from the pandemic has really heightened some of the issues that were already really challenging for many parents in the service sector. Mm-hmm. So these include things like unpredictable and unstable work schedules. We've seen that increase tremendously during the pandemic. Mm-hmm. And those were things that were already very difficult for workers in the service sector that make balancing work and family care responsibilities particularly challenging.
And are you talking about retail work with the crazy shifting schedules all the time?
That's right. So in our study, we're following folks working in retail, food service, and hotels. Mm-hmm. And in each of those sectors, there are a tremendous amount of unanticipated changes in work schedules. So even before the pandemic, for example, 10% of all days, the parents in our sample said work did not go as planned. Maybe they got sent home early or had a shift added to the schedule, the day before. There are all kinds of ways that retail, food service, and hotel workers have changes to their schedules that they don't know are coming in advance.
And Keisha, what are you seeing?
Well, I think that there's, it goes along with that when it comes to families, because with that shift in your schedule, it obviously impacts your childcare, but also impacts your household income. Right. So if you don't know what you're making by week to week, especially if you don't qualify for some of the safeguards that you would get for unemployment or having a modified schedule, so you might not meet that threshold. So you're on that tipping point. I think that it's very key to look at this, and especially when we know that Black and Latinas are overrepresented in the service industry, especially Black women and Latinas. That this has a disproportionate burden on Black women and Latinas.
And Tiffany, what have you seen?
Yeah, so I also want to thank you all for having me this morning. And so the work that we do within the Ascend program at the Aspen Institute is really focusing on a two-gen or whole family approach to policy and systems change. So what we're seeing is that many of the disparities and challenges that families were experiencing have only been exacerbated, to Anna and Keisha's point. Right. And so when we think about some of the barriers within state systems with being able to administer benefits timely, with being able to, streamline services, all of these things have come to a head at this point, to the point that we're unable to it can never go back to what it was before this moment. And so because many of these issues have been illuminated, we are called really to meet the moment and not only address the issues that have really risen to the top, but also pave a way for increased economic mobility for families moving forward. So I think more broadly, what we have seen is just an exacerbation of all of the disparities that have been longstanding in BIPOC communities.
When you say we can't go back to the way it was, can you talk about that a little more? What do you mean by that?
Absolutely. So I think that many of these systems and programs were created without the other in mind. And so when you have siloed programs and siloed funding streams, there is this inability to be able to integrate and link systems and funding streams to serve families more holistically, right? And so I think that—
Can you give an example of that?
Yeah, absolutely. So data systems, for instance, especially in state systems. So just bringing just full transparency, I've been on the user end of the state system. So I'm a Head Start alum. I was a Head Start mom. I was a student parent as well, right? So I've had to navigate these very complex systems throughout my life. I was also within state government in Tennessee for 7 years under the Housing Administration within the Tennessee Department of Human Services. And so I've witnessed firsthand the challenges for practitioners and policymakers in those state systems moving from a regulative to a more generative business model where you're compliance-based. And because TANF requires this, and child support requires that, and SNAP requires that, frontline workers, folks are really just checking a lot of boxes, but not unable to be intentional about how they are working with families. And so how can we streamline processes? Where are there opportunities for universal applications? Where are there opportunities to update systems so that we're tracking outcomes for the entire family? Versus within this system, that system, and this system that are all likely green screen legacy systems that don't speak to one another. So it's impossible to know, for instance, if your caseload decreases, that is not necessarily a sign that families are better off. They've likely timed out and there's no way to track them anymore because the systems do not speak to one another. And so just more broadly, those are some of the issues that we really advocate to influence, through this work.
Can you talk a little bit about how COVID has, give some examples of how COVID has just complicated, that kind of those siloed systems so that, it's hard to get people help and for people to access the help that they're.
Yeah, well, I think what I'll speak to is a lot of and I'm kind of approaching this from more of an opportunities lens, is that many of the waivers, so there have been a lot of waivers granted to streamline and kind of ease administrative burdens for, frontline workers as well as families, right? So instead of having to go in to recertify for this program and that program, every 3 to 6 months, those have been waived. And without going into specific detail about each waiver, because they're plentiful at this point, how are we leveraging the lessons from the impacts of those waivers to inform programs moving forward, right? So instead of, if we were able to implement that waiver and have it benefit families and folks on the administrative side for a year, why has that not been the way that we've done business in the past, and why shouldn't that be the way that we do business in the future?
Interesting, that makes a lot of sense. So let's talk about the vaccine rollout. What kind of structural inequities have you guys seen with the COVID-19 vaccine rollout? And in what factors and considerations should we be paying more or less attention to, especially among marginalized groups?
I think one of the key issues that I've seen is that with the exception of those who are in nursing homes, the vaccine has been prioritized for people who are exposed to other people and communities who are at risk rather than the people and communities that are actually at risk. And I think that's something that we actually have to tackle head on. So we know that Black and the Latinx communities have an overburden on both getting COVID, being hospitalized by COVID, and death, right? So we know that that's happening, but they're not getting the COVID vaccine. And by different, well, one of the talking points that is frustrating, that is real, is vaccine hesitancy. However, just because it's real doesn't mean that it's the only reason, right? We also have to talk about availability. We were talking, Tiffany was talking about bureaucracy and being able to get through systems in order to actually get an appointment.
Right.
And not properly using the resources within communities to help navigate. So for example, and actually to get back to vaccine hesitancy and that emphasis, before I talk about the solutions, we know that roughly 40% of Blacks and Latinos have some form of vaccine hesitancy. So either saying, I have some concerns, all the way to I'm never getting it. But for the most part, most people are saying, I just have some concerns. So basically, you first, right? But what it doesn't do is talk about the 60% of the folks who are saying, yes, I'm ready right now. So while the focus has been on that 40%, no one is addressing and making sure that the 60% of folks are getting it. And no one's looking at how back in November, roughly 40% of white Americans had COVID vaccine hesitancy. And now we're down to about 15% for the white community. So when you think about it that way, what were the strategies that worked? I think a big part of it is when you know someone who's had the vaccine and hasn't had a severe adverse reaction, that it makes it easier to do that. But when you have whole communities where you look at specific zip codes in Alabama where no one has gotten the vaccine, how can you say you go first when you don't even know who's gone first, right? So those are the issues. And so in Philadelphia, the Black doctors' response to COVID, I think it was last weekend, they actually beat Philadelphia's average, daily average in COVID vaccinations, with 60% of the people who got it being African American. So they had over 4,000 vaccinations in one day because they actually got community organizations and churches activated and engaged, did a 24-hour cycle, which meant that people could go before and after work. That and they prioritized the elderly and specific zip codes that were hard hit by COVID. So all the strategies that we know when it comes to any other public health crisis, they actually utilize that. The COVID may be new, but the strategies to actually implement are not new. And that's what we need to go. We knew how to do souls to the polls. We need to know how to get everyone to the vaccine.
So would you say that's a model that can be duplicated around the country, or is it very Philly specific?
No. I think it's something that can absolutely be duplicated. We're starting to see here in Durham, we're starting to see that strategy working very well. There's people who want it. At Duke, the Black COVID Response Network partnered up with community organizations. They put out a sign up for 250 people. And in less than 24 hours, they had a waiting list with an additional 400 people. So folks want to do it, want to take this vaccine, but they need to have trusted folks come out and reach out. And you actually need to go to where people are. We also need to interrogate, the ways that people are eligible. Is it about where you work or is it where you live? And so are the people, if we have county-wide vaccinations, well then, do you have to live in the county or do you just have to work in the county? And you actually have to look at those numbers to say, well, are the majority of the people who are getting the vaccine actually in these counties, or are they people who live in the suburbs who are commuting in? So that also can exacerbate these numbers, which is why we have to actually account for the racial breakdowns. So states, the CDCs have to report the racial and zip codes of the people who receive the vaccine, because right now less than half, I think about half of the states are reporting by race, and it's a little bit less by zip code.
And some of these disparities that we're seeing is with vaccine access, is that because you have, privileged folks who are jumping the line? We've heard some very, high profile cases of people dressing up like old people or doing all kinds of stuff to
I actually
game
don't
the system.
think obviously there will always be people who game the system, but you actually have to look at the system that's in place. Even for the states who held out longer with the 75 and over, we know that the mortality rate for African Americans is roughly 74 to 75. And in the last year, that number has actually decreased. So if you're looking at who meets the criteria as far as age, Blacks, people of color in general skew younger, which is why when you look at the COVID numbers, they tend to be age adjusted.
Mhm.
They skew younger and are also younger when they're hospitalized or have unfaced death. The other, so besides for the age aspect, you have to look at our healthcare workforce. Our healthcare workforce is overwhelmingly white. Here in North Carolina, we just moved teachers up on the list. Teachers, not just here in North Carolina, but nationwide, are overwhelmingly white, no matter what the demographics of the city are. So as states and cities and states are readjusting, they're not readjusting in ways that actually make the people who are most vulnerable to COVID get better access.
Interesting. I want to switch it up and talk a little bit about paid family leave and childcare services. And so those were already areas of challenge pre-COVID, especially for service industry workers who are disproportionately people of color, as we've talked about before. How have those disparities increased during COVID-19, and what are some of the impacts that they're having on families and individuals?
So I think, again, the issues that have been raised around COVID-19 really have highlighted pre-existing issues and disparities that were already there before the pandemic. So access to paid family leave is a great example. Here we are in the middle of a pandemic where we're all of a sudden, all of us seeing, wow, we could have a serious health problem that would require us to take time off of work. This is not something that was planned. Right. Or have an elderly parent who has a serious health problem who requires care. And I, as the child, need to take time off of work to care for my parent. I think that the pandemic has really brought that issue to the fore. And our system of leave in this country does not provide a safety net for most workers to be able to take time off and continue to have income while they've stepped away from work. So we primarily have a system that links access to paid leave to employment, and that is highly unequal. So low-wage workers, service sector workers, who again are primarily people of color, on average do not have access to paid family leave. It's the higher income workers who do. And so that means so many working folks are in a bind where they have responsibilities to care for their family, to care for their own health, but they also have bills to pay. And family members who need to eat, who need food. And so these economic pressures are real, and paid family leave is an evidence-based policy that connects people to their jobs, keeps people actually in the labor force because it allows a path to step back and care for a family member or care for oneself, and then come back into the labor force. This is something that keeps women in the labor force. We've seen during this pandemic how many women have stepped out of the labor force. We see that in our own data, in our own study. Here we have a sample of working parents, primarily women, and nearly 10% of the people in our sample have told us they've dropped out of the labor force since the pandemic started. And that, and so paid family leave is something that an increasing number of states are now rolling out, but should be something that we are considering across the country.
And is there a move? Is there a push? I mean, is this something that should be handled at the federal level? Would that be the most effective way to enact an equitable paid family leave program?
Well, that's a great question. So I think, what's happened in the absence of a federal program is that states have stepped forward to fill the void for their communities. And state policymakers have realized this is, the kind of policy that will help build our workforce, can be implemented in ways that promote equity, that help lower wage workers and workers of color in particular have resources that they need. But of course, what that means is that now folks in those states have access to paid leave, but folks in the majority of states don't. And what a federal policy would do, of course, would provide that access to paid leave for everyone across the country.
Which states are particularly good at that, are really getting that right, paid family leave?
So the leader was California. Their program has been around the longest. But I think, and what is very interesting about California's program is that as they've changed it, they've made it both more generous, so longer leave length, and a higher wage replacement rate, which just means folks getting more income while they're on leave. And what that has done is actually promoted equity. It has allowed lower wage workers who really need that income, and primarily workers of color, to be able to use California's paid leave more. So it's increased uptake for low wage workers and workers of color, and then also promotes maternal health and child health. And so other states, I think, have kind of kept their eye on California, and as they've done their initial rollout, have really been focused on these equity issues from the beginning. And so that includes, for example, the state of Massachusetts, which really went into that statewide conversation with a real focus on equity from the very beginning.
Interesting.
All right, I wanted to switch it up a little bit and talk about. I'm sorry, Tiffany.
No problem. It's perfectly fine. Anna, those are really great points. When you brought up California, it made me think of one of our bodies of work, which is the Family Prosperity Innovation Community, which is really focusing on, pushing for not emergency, but permanent paid leave policies at the federal level. And so Legal Aid at Work, which is based in California, has done a lot of work with, helping to really eradicate the disparity and the equity issue with folks being able to access those benefits, because they're having to navigate, again, these complex systems and not knowing which agency, to contact for which benefit. And so by creating these fact sheets, they've really been able to raise awareness and to help, families, be better aware of the benefits that are available to them. I think one other thing to keep in mind is the importance of how family is defined in a lot of these policies, right? And so how are families defined? Who gets to benefit from these policies? When can leave be used? And so as these policies are developed at the federal level, it'll be important to keep that in mind. I think historically states have innovated, by exception, which is wonderful, but it also leads to this lack of standardization across the state. And so by having, changes made at the federal level, it will, create kind of a pathway and some guidance for states, so that these are not one-off approaches. I think the other thing that I wanted to hit on was, this issue of childcare, access to equitable childcare and quality childcare, and then also this underinvestment in the childcare workforce. This has been a historical issue. This is not new, but again, has been exacerbated by the COVID pandemic. So whereas you had, 30% turnover, every 5 years, that number is constant. And then you have so many childcare providers who close their doors because of this issue, right? And so it's going to be really important that we not only increase access to quality childcare, but that we really invest in the childcare workforce. I hope that everyone is on the same page in that regard moving forward, because again, this pandemic has impacted everyone, but it has definitely had disparate impacts on communities of color, which leads me to, I think, a point that you mentioned, Keisha, also thinking about like stimulus payments, who's being able to access those payments? Communities of color, families of color are using those payments to pay for household expenses more so than their white counterparts. And so how are we even thinking about, this issue of poverty, being able to access these payments, just all the disparities across the board. It just kind of leads me to just wanted to touch on that before moving on. So thank you.
Tiffany, I'm glad that you talked about the stimulus, because there are those who will argue, well, you can't just throw money at problems, but sometimes your problem is money. And so that's actually what you need to solve that problem, is to give people cash so that they can pay their bills, so that at some point, these moratoriums, because they are moratoriums and they're not relief, people have to pay these back rent and pay the electricity. All those things have to happen at some point. So we have to actually put money in the pocket. So I'm glad that you brought that up. Throw money at the problem, please.
Yes.
That will resolve some problems.
It will. And then the on-hand cash has been reduced so dramatically, since welfare reform in '96, cash benefits have decreased significantly for families. So again, having on-hand ready cash for emergencies is just not a thing for, many families in this season and just generally speaking. So yeah, I completely agree with you.
I just want to stop 1 second to say, attendees, please submit your questions, because we're going to open up the floor in a few minutes. So so feel free to just pop in your questions in the chat and we will get to it. So given all that we were just talking about, what are the ways that Congress should be reframing their focus and how they approach and prioritize issues in relief? Is it just passing a massive COVID bill and, as you said, just throwing cash at the problem?
Well, I think there's some
how much should they be giving people?
Well, I think Tiffany can answer probably better about how much to give to people, but there's also some, I love that, the infrastructure, right? Is that we knew that there were problems with the infrastructure, both in how we provide relief to individuals and families, but also in our healthcare system. We knew that there were infrastructure problems. And I think even when it came to the COVID testing, as well as having the transition and pivot from COVID testing to COVID vaccinations, using those exact same resources without expanding them, has really illustrated that the infrastructure needs to be built. Because although we need to respond to COVID, hopefully, God willing, COVID won't be here forever. And we need to make sure that the things that we build up, all the things that we said were impossible to do, 14 months ago, well, that's impossible to do, that we've been able to do, that actually lays a foundation for long-term plans. So all these solutions that we're looking at should be solutions that deal with the foundational issues that go on. So Tiffany was talking about childcare workers. We need to build that workforce. We know that for every child development center, pre-COVID, there were 2 children who were waiting on a spot. Now we know it's 4 kids. So that means we need to build that workforce. Do we need to have a federal jobs guarantee where we build up that workforce and actually understand that this is a prized skill set? I know a lot of folks, when daycare centers closed, suddenly had much more respect for what both teachers as well as what childcare teachers, as well as teachers' aides, who are overwhelmingly Black and Latina, that the work that they do with their children every day. And I think that's something that needs to be part of that infrastructure that is built in a COVID response.
So Tiffany, how much money should we be throwing at this?
Well, I am no economist, so I can't give you a number. However, I do know, and the way we work at Ascend is we work nationally through our 2Gen learning community, our national network of now more than 430 partners who bring these stories to us all the time and tell us about this, need for cash assistance from families. I think that moving forward, I think it'll be important again systems change cannot happen in a vacuum, right? So there have been proposals, to increase the minimum wage to $15 an hour. That's wonderful. And it's something that, quite frankly, we should have done $15 probably like a decade ago, but I'm glad that we're moving forward. But it's going to be important to think about, okay, if you increase the minimum wage to $15, how is that going to impact the benefits cliff for families? Families are going to get an increase in pay, but if you don't correct and reconcile for that increase on the benefits and eligibility side, then they will top out and they will not be able to access childcare, TANF, SNAP, right? And so we cannot continue to create these policies in vacuums. I think that moving forward, so also at Ascend, we talk about like little P policy and big P policy. Little P policy, those are platforms, from which we can really build some sustained changes, right? Some sustainable changes within systems. Big P policies are, of course, specific policy recommendations. So from a little P policy perspective, at the federal level, within HHS, there is an initiative to establish an interagency council on economic mobility. What that will do is create a platform for federal agencies to increase coordination and collaboration so that there is not this siloed approach to policymaking, to funding, to programs. And that will hopefully trickle down to the state level and free up states again to be able to do this work more effectively, more efficiently, which will lead to better outcomes for families. So I think that's the piece we're really getting behind is if we build the infrastructure, then hopefully whatever comes from that will be more comprehensive and lead to a more integrated approach to serving families.
So if I can just build on that as well, I think there are a few additional points that I'd like to add to Keisha and Tiffany's really important points here. The first is that in terms of the social science literature, which has been moving and responding to the pandemic incredibly quickly, we actually already have evidence. And I know for the policymakers listening in, this might not sound fast, but this is incredibly fast, that the stimulus and other supports from the CARES Act that were made available to families in the spring and summer of 2020 really worked. We know that. Those specific provisions were incredibly helpful in stabilizing family income and promoting family well-being. So any additional stimulus, as families are still struggling, based on what we've learned from the CARES Act and the spring and summer, we know that any additional stimulus is going to immediately help continue to stabilize family income and promote family well-being. So that's one really important point I wanted to make. Second, to Keisha's point about learning from what's happened as we move forward, I think a great specific example of that is the summer 2020 solution to summer meals, which is the PEBT program. Rather than coordinating a cumbersome set of distribution sites and boxes and pickup times and days that put the burden on families to keep track of, where is the food available this week? What's the site? Have I missed the hours? How am I going to get there? The PEBT program simply said to families, here's money on this card that you can take to the grocery store to buy food for your children for the summer. That is an incredible innovation that we should certainly be thinking about continuing even after the pandemic, because that is a way of supporting the nutritional and economic needs of children and families in a way that reduces burden on those individual parents and allows them to control when and how they use that support to feed their families. And then the third point, just building on Tiffany's little p, point about little p policy is I think the pandemic has also highlighted how we need to think about ways that we are choosing as a policy choice to make accessing safety net programs difficult, and whether this pandemic has perhaps caused us to pause and think, is this the way we want to continue doing this? So the unemployment insurance system, which we have not talked about very much yet today, is the key safety net program for people who are laid off. And in many places, including, for example, right here in North Carolina, we have made accessing unemployment insurance difficult as an explicit policy choice. And the notion is that that will make it so that only people who really need it get it. But in practice, what that means is that folks who are facing the most barriers and have the most difficulty are actually the ones who aren't able to get it, and folks who have relatively more advantages and who can navigate these systems, as Tiffany's been talking about, are much more likely to get it. And so we see that, for example, in our own data, where unemployment and access was expanded in response to the pandemic, not everyone who applied was able to either get through the process or to get their benefits. And that was different for different racial and ethnic groups. So for example, in our sample, our Black workers who were laid off were more likely than the white workers to get through that process, but for whatever reason, have a delay in getting their benefits. And when there's that kind of delay in processing benefits, it means families are struggling with the basics like food and rent.
So what is contributing to the delays? Is it a lack of access to a laptop and the internet, or like, that's interesting to me that
so
they
I
got
think
through the process, but they still had a delay.
That's right. So I think actually the delays are really on the system side, not on the individual families. So we're talking about offices that have been historically understaffed, computer systems that are actually old and are not set up to be nimble, to be able to quickly process new types of benefits or benefits for people who are newly eligible under a different set of rules. So the systems themselves, the actual computer systems and the logistics within the offices are not set up to be nimble and responsive. And that then ends up playing out in ways that are unequal.
We have a question from the audience. This first question is from Maya Goldman, and Maya is asking, what would you like to see the Biden administration do to address inequities in health coverage right now? Who wants to take that on?
Well, the first thing I would say is that I don't believe that health insurance should be tied to employment, especially when we know that for low wage jobs, or even mid-wage jobs, the insurance can be the underinsured issue, and what qualifies as being underinsured is just all over the place. And if there's any gap in employment, it can just set a firestorm in your life. And so I think that's one of the issues. But we also need to make sure that we actually hold accountable, and actually not just hold accountable, actually take into account our longstanding health disparities, and to actually look at what the numbers are, who is living, who's dying. So and for things that we know how to treat. So we know heart disease is something that pretty much hits everybody in this country along racial lines. Everyone has heart disease at roughly the same rate. However, the burden of heart disease is much heavier for Black people. We know the burden of diabetes is much heavier for Latinos. Those are the issues that we actually know how to treat, but we're still seeing these high rates of amputations. And so I think we actually, that doesn't have to happen. So things that we know how to treat, we're not collecting the proper numbers so that we can say who are, and not collecting them, and then analyzing them and making them public so we can know who is receiving quality care, because it's not just being able to go to a high a highly ranked facility, but to make sure that people are getting the same quality of care and advice. And so I think that that has to actually be accounted for so you can know what these disparities are. A lot of the things that we see around maternal health and mortality and morbidity, and that's the big issue, is morbidity is often not accounted for. And morbidity is when you have near misses or severe illness that's associated with the disease, doesn't always get accounted for. And that needs to be accounted for as well, so that we can know where the holes and the gaps are in the system. We know that these aren't genetic differences, these are social differences.
But often it's framed as their genetic.
Absolutely. Because what I always say is, well, how Black do you have to be in order for race to be a factor in your health? So, is it a matter of if you're biracial but dark? If you're like my grandmother who had 4 Black grandparents but was very fair skinned, how Black do you have to be in order for it to be a genetic or a racial issue? So that's my counter.
That's a really good point. Yeah.
It is. And it makes me, when you mention the structural thing, there's a conversation happening at the national level and really shifting from this idea of social determinants of health to structural determinants of health, because it really and truly is the infrastructure, right, or lack thereof, or structural racism that has been in place for, since the beginning of time here in America, that is really preventing families from accessing adequate health care, adequate food, schools, all the things, again, that contribute to one's health. There is a disparity there. And that conversation is actually being led by one of our fellows, Dr. Wendy Ellis, at GW. So that's a big thing. I think the other thing that was kind of mentioned is this idea of worthiness. So Keisha, you mentioned that, healthcare being tied to employment is a real issue. I think it gets to, it's so deep that, this person deserves health insurance, or this person deserves financial assistance, or deserves because of this, versus just recognizing and acknowledging the humanity of all, needing, situational poverty versus generational poverty. There should not be such a difference made between the two. And generational poverty should not exist in America.
Anna, any thoughts on that?
So the one thing that I want to add in to the conversation is I really think we all need to be acknowledging that kind of an underappreciated aspect of the current crisis with the pandemic is an ongoing mental health crisis, especially for parents who are juggling so much. So for example, in our work, we gather information that screens everyone in our sample for major depression and for generalized anxiety. And in our sample, half of the parents are screening positive. So that means they are likely experiencing serious depression or anxiety, or both. Those are unbelievably high rates of mental health problems that I don't think are unique to our particular population, although of course, for all the reasons that we've been talking about, make accessing mental health services more complicated. And so I do think this is going on across the country and is really something that we all need to be thinking about how to invest in building up and supporting our mental health services infrastructure.
And how do you do that? I mean, and we're in the middle of COVID, we're locked down, most of us still. So, and even in the best of circumstances, I have a mentee who is struggling to access mental health care, and it just, she's just encountered all kinds of obstacles. So like what are some of the answers? What are some of the solutions? If it's already, COVID is complicating a situation that's already highly problematic.
Right. I think that's a really important point. It's yet another issue where this existed before. We saw this, right here in North Carolina, for example, before, with challenges around getting mental health and behavioral health services to our low-income North Carolinians. These have been exacerbated by the pandemic. I think it starts with really acknowledging that mental health and investing in mental health is just as important as investing in physical health. These are real health problems that make balancing all the other things folks have going on particularly difficult. And so when we think about, and yet so often the mental health services is seen as separate or not part of our kind of health services. And so I think even just as a starting point, really thinking about integrating mental behavioral health services with our broader health infrastructure would be a starting point.
So we have
absolutely.
I'm sorry, go ahead.
Oh, sorry, I was going to say that for mental health, one of the barriers, so one of the things that was seen as impossible was the telehealth aspect of both for physical health and mental health. But there were waivers in physical health as far as doctors being able to work across state lines that haven't necessarily been implemented on mental health. So those waivers, so that in places where you may not have to be able to get more access, to expand the access to mental health care, if people are booked and you can go somewhere else virtually to get that care, you should be able to have access to your license should be able to be transportable so that people can get that care that they need quickly. And I think that that's something, and I think the other aspect of the mental health as well as dental and vision, but also the infrastructure as far as disability. Folks who are disabled and haven't had good access to care, I feel like COVID made a lot of folks who would be considered in the abled population realize how precarious their care is, as well as their safety and health, and how the system is not really set up to make appropriate accommodations system-wide. And that's part of that standardization that needs to happen at the national level so that it could be implemented at the state and local level.
Absolutely.
So we have a question. I'm sorry, Tiffany, go ahead.
No, I was just going to say, in both of you all's points, thank you, Keisha and Anna, really also underscore the digital divide that still exists in America, right? Which is another inequity, is now we have to have access to digital, we have to have access to computers and to networks in order to be able to access these services. And so I think that as we move forward, it'll be important for those investments and that for that infrastructure to really be put in place at the federal level so that families are able to access. And I think that, to your point, Anna, connecting physical and mental health is so imperative. Through the two-generation approach that I speak of, one of our core components is this, health and well-being component, which encompasses physical, mental, and emotional health. So thinking about adverse childhood experiences, thinking about brain science, toxic stress, poverty as a traumatic experience, and really being intentional about addressing many of those issues, as we partner with families moving forward.
So we have a question from Sean Smith. And Sean's question is, isn't it more important for the legislative branch of our government to put forth legislation and pass that legislation than the executive branch of the government? Shelf life of executive branch is 8 years and technically 4 to 5 to be effective. Legislative branch can be in place for 10 to 30 years. Who wants to take that on?
So one thing I can say in response to that question is, one thing that the legislative branch can do is set up policy change now that can be persistent and responsive to future crises. For example, the CARES Act, I said, really did make a difference, but we also found in our own work that folks who were relying on the expanded unemployment insurance benefits and eligibility through the CARES Act were very aware that that was time limited, that it was going to run out, and that they did not know what they were going to do when it did, that they were seeing this cliff coming and were quite worried about the financial implications for their families. What the legislative branch could do would be to build into the legislation changes, for example, to unemployment insurance that are responsive, right? So that that is predictable and known to program administrators, but then also to potential program recipients.
I want to clarify, Sean just clarified the question was specifically when discussing healthcare reform regarding legislative changes.
Well, I can't fully answer that question, but I'd like to see both the executive branch and the legislative branch try and to make that happen. I mean, we know that the legislative branch, when it came to the Affordable Care Act, you know, that it was used that way with a combination of the executive branch, but obviously it's been fought in a battle. So I wouldn't necessarily say that just because something is passed by Congress means that it is guaranteed to last forever or without any changes to it. My issue is that you don't just wring your hands because you're going to say, oh, it would be better if someone else did it. You actually have to do something. So my answer to that is I'd like to see everyone try, and then we can, if everyone is working together, then we can actually have sustainable change.
So we only have a few more minutes and we have a few more questions. So I'm going to kind of roll through them. So hopefully we can get through all of them. So the next question is from Juan Lopez, who asks, can we get a list of the research done about the positive effects of the CARES Act has had on the population, social services like unemployment benefits and others? Is there somewhere we can get a list of that, or?
Sure, I'm happy. I have published an evidence brief through the Society for Research and Child Development that focuses on families with children, but I'd be happy to work with the Duke and DC folks to get that evidence brief sent around to anyone participating today.
Okay, and then we have a question from Katie Edwards. How important is the work of DEI for educating the country around health disparities affecting the Black and Brown communities outside of COVID-19?
I think it's key, and I say this with a caveat, right? So that it has to be with myth busting. And I think whenever I do talks around health and equity, I have to spend the first 5 minutes talking about this is what you've been taught, and especially around maternal health and infant health. This is what you've been taught, but this isn't necessarily what's true. A big part of doing the work and finding out what really needs to happen is disaggregating the data, which means that we actually break things down, not just looking at comparing people by race, but also looking within race and saying, well, who's doing well, who's not, and learning from success and being able to replicate that, but also being able to compare apples to apples. So am I comparing wealthy white people to poor Black people and expecting the same outcomes? Or do you find out that when it comes to something like infant mortality, that Black women with education who have a bachelor's degree or higher actually have poor infant mortality outcomes than white women who haven't graduated from high school? Telling those types of things that actually show, because it's easier to talk about class, it's easier to talk about poverty or access than it is to talk about racism. So I think that you have to have these diversity, equity, inclusion conversations, but you actually have to be forthright about what we've been taught in the past and how it's not accurate and what we need to do. So as long as there is myth busting as well as action or a plan that comes with it, how you can do better in your sphere of influence, that's how it can be effective.
So how do you, go ahead, Tiffany.
Go ahead.
Okay, so I wanted to ask, how do you myth bust? Because, you know, there's a thing that's been very striking to me since the George Floyd was killed was how systematic racism has been, you know, people are much more comfortable talking about it now. But there's still people that don't believe it exists, that really dispute that. So how do you myth bust, you know, in a country where we're so divided and, you know, people just, so yeah, so how do you do that?
Well, so I'd like to start with that, and also building on what Keisha just mentioned. I think disaggregating the data and myth busting is important. I also think that how we approach addressing implicit biases and all of the things that got us to this point in the first place, right? So I think sometimes we speak of systems and policies as though they created themselves. No, people created policies, people created systems. And so if we want to ensure that we do not end up here moving forward, then we also have to shift like the hearts and minds of people. I think when it comes to myth busting, we at ASAN have worked with the Frameworks Institute, and a lot of what they share is not repeating the myth, but reinforcing the message, right? So 9 times out of 10, if you are having a conversation with someone, they remember what you say most. So we should continue to state facts, not repeat the messages, the myths, right? So in dispelling the myth, don't repeat the myth. Continue to push facts, push data, and push evidence in order to really shift hearts and minds in order to move forward.
Anna, do you have any thoughts on that?
I think, Keisha and Tiffany have done a great job covering this really, really important issue. And I think, one thing to add is as we're thinking about this messaging, to, I think, really be clear about drawing the line from the historical past, right, to the current moment. So, for example, when the employment insurance system was created, the eligibility rules were explicitly drawn in a way that excluded Black workers, right? And so even though those have gone away, there is a legacy that continues, right? So that to understand where we are now means understanding where we came from. And as we think about the messaging, I think it's really important to understand how those rules were originally set up and who they were meant to benefit and who was explicitly not included in those safety nets.
That's a very good point. All right, we've got about 3 minutes left, so we've got one more question. So we'll keep it tight and concise. And this question is from Mary King, who wants to know, how do you see local grassroots organizations like mutual aid affecting federal and state programs?
I'll kick us off here. I think that it's shown how the importance of community, and that, addressing poverty it doesn't belong to one sector. It doesn't belong to one program. It's onto all of us. That's why it's so much more important to work collaboratively, to take an integrated approach. So I think that mutual aid it complements these systems that are already in place. And we should really, innovations happen in communities. Communities have been doing this for forever, right? And so how are we, policymakers, systems changers, how are we learning from the work that's already happening on the ground? How do we operationalize that and have that really inform policies and systems? So I think that mutual aid is affecting federal and state programs in a positive way, and that we should really look to communities to guide the future and families.
And I'll briefly just add to that in addition to mutual aid groups, another important community organizing group is, of course, labor organizers. And so why are we having a conversation about increasing the minimum wage to $15 an hour? Well, that follows from a tremendous amount of organizing by workers who have been arguing for this need for an increased minimum wage for a long time. And this is true around minimum wage. This is true around the need for paid sick leave, which has, of course, been heightened our awareness during the pandemic. This is true around local and state ordinances that will help stabilize and regulate work schedules that are highly unpredictable. So our labor organizers have really been strong community voices that we should also be listening to guide policy choices moving forward.
Okay. Well, that pretty much wraps it up. This was great, and I wanted to thank everyone for joining us and to let you know that the event's recording will be available from the YouTube link. And I wanted to make a pitch. I am, as I mentioned before, an editor at Politico, and this week we launched a new newsletter called The Recast, where we look at race and identity through the lens of power and policy and politics. And so please sign up. We publish on Tuesdays and Fridays, and we would love it if you, a lot of these issues we're trying to talk about as well. So love it if you would subscribe. So thanks so much. And thanks to our wonderful